Hey everyone, it's Dwayne and Tremia, and we're here to kind of catch you up on everything that's been happening since May. A lot's been happening and going on, and me not really feeling well, and so Dwayne's gonna help me catch up on it and explain a few things. The first thing I want to start off with is I had mentioned a long time ago that we were going to go into a conference kind of office visit with my rheumatologist and the lead doctor at the clinic, because all of us, we were all kind of not on the same page. There had just been so much happening and going on, and we all needed just to bring our heads together and find out where we stood. And so, and it was about a 2-hour visit, and it was really needed, and it was really beneficial. When we went in with 2 pages of notes of, things that we had questions on and needed more understanding on. And so I'm gonna kind of go over like what we asked them or what was brought up, and Dwayne's gonna explain what the doctors said to us. The first thing we went in, it's just like, okay, where are we standing with the lupus diagnosis at this point? Is it active? Is it not active? Remission, is it full blown? What is it? Because I'm so sick, but we just couldn't figure out. So I'd written down like the criteria that I was experiencing at the time for the systemic lupus diagnosis. I was having and still having the malar rash, photosensitivity, oral ulcers, arthritis, pleurisy, anemia, and so that was the criteria that I was meeting at the moment.
Yeah, so I guess the big question was, why weren't they treating lupus for Tremia? Because they weren't. It's like a lot of debate if she still had lupus or not after the stem cell transplant. And then once we went over the list, we were trying to explain, or the doctors were we were all trying to think about what was causing everything, or what was causing some of your other symptoms, like the spasms you're having, the osteoporosis, the bone density, some other things like that too, along with the lupus stuff. And then what they concluded and what they talked about, they were talking about whenever she first started coming seeing them at their doctor's office, how bad she had lupus and how bad it was, how life-threatening it was, how it was attacking her lungs, how it was attacking her vision, optic nerve, and then also her GI tract. So, and he was saying how bad it was and how basically they were doing everything they could do to pretty much keep her alive. And he said, so that's why they recommended, and we kind of searched it out ourselves, the stem cell transplant, to see if we can do something to slow down or get rid of the lupus. We knew going into the stem cell transplant that it was a 50-50 chance that it would take the lupus away, or at least that's what the studies have shown. That 5 years later after the transplant, 50% of the people did not have lupus anymore, or didn't have traces of it, but 50% did. But even the ones that did, it may not have been as bad as it was initially. So they talked about that, and then they talked about the fact that after the stem cell transplant, that basically we're looking at she still has lupus, because we still have some symptoms of lupus, but he said, in his words, a gentler, kinder lupus. Basically not a lupus that she's having to fight for her life, but a lupus that's just basically, you know, and lack of a better word, being a nuisance. You know, it's not life-threatening per se, the lupus symptoms she's going through. But then, you know, but then we had questions about all the other stuff, like the osteoporosis, and like she has like stomach spasms still, back spasms, and just you know, a slew of other things. And so so what he was talking about, he said, what we're looking at is after the stem cell transplant, the lupus is much better, and you're only down to a couple of symptoms really that are related to lupus directly, and they're the ones that she named right at the beginning of this. So he says, but all these other symptoms that we're seeing, they're related to damage from lupus and damage from the treatment of lupus, because they had to treat her lupus pretty harshly with you know, pretty much years of chemotherapy, and then, you know, all that chemotherapy can cause damage. You it's like in the side effects, you know, and the possible side effects from chemotherapy, but all that over time can cause damage to your GI tract and some other things. And then also the high dose steroids that she had to go through for several times, you know, like a gram, you know, a day for several days in a row whenever things got bad. Now that happened several times, and that's what caused the severe osteoporosis. And then, so that's why she had all the bone fractures that she had, all the back fractures that she had. So, you know, and then now that those have been treated, you know, her bone density is still low, but she doesn't have any new fractures. But now, what that means is she's still, you know, her body's, you know, in pain, and, you know, from all that. So he said that what we're looking at is just damage from how bad the lupus was before, and how strong they had to treat the lupus for the damage from the treatment from the lupus. And then, but as far as the lupus itself, that she's really doing, you know, a lot better as far as, you know, lupus is concerned. So overall, he thought she was doing, you know, better than what she was before the stem cell transplant, you know, and I agree. I mean, she is doing better. There's been a lot of bad things that happened, and it's been a really rough road.
Yeah, as far as lupus, the actual disease itself, yeah, I can say after, you know, going into the conference with them and understanding, you know, the actual disease itself, yeah, it's better. And, you know, the only things that are treatable and is the malar rash, photosensitivity, oral ulcers, arthritis, and pleurisy, and they treat that with Plaquenil.
Right.
So Plaquenil is the only form of treatment towards the lupus. I'm still trying to work my way down off of the prednisone.
Right. Slowly.
Yeah,
you have to go slow.
Is that still aiming? Is that towards the lupus, or is that towards adrenal insufficiency? Or
it's towards the lupus. So he's still on steroids due to the lupus, and Plaquenil due to lupus, and they have us tapering off the steroids, but very slowly.
Yeah, because it seems like the furthest I can ever get down to is 12, and then something, bam, you know, happens and knocks me back up a few more. Right now, I've been stuck at 15 for like 3 months, haven't I?
Yeah, 14.
See, he fills my pill bottles, and he doesn't tell me what he does.
Yeah. So you've been at 14 for like 2 weeks.
Oh, really?
Yeah. So,
I'm doing better than I thought I was.
Okay, but that's pretty much it on what the doctor talked about that day.
Yeah, and so it's like it's just damage control, as he said, is how he put it, right?
Right.
It's damage control. You know, the osteoporosis is due to the prednisone, which is due to treat the lupus. And so right now we're doing damage control. I had to have you know, my back fractured in 15 places. I had to have 15 surgeries, 15 kyphoplasties, and I have to take that injection, the Forteo injection, every day. And but my bone density hasn't increased, but it hasn't decreased. And they said, somebody just recently said that, you know, if you're holding your own, that's an accomplishment, as long as it's, you know, not getting worse. But like Dwayne said, you know, my bones, like those 15 bones in my back, those have fractured and those are fixed. But the rest of the bones in my body still are osteoporotic. You know, my hips, any bone is, you know, at that critical state, and they can fracture. And that's still why the physical therapy hasn't begun yet. Because, you know, we got to protect the bones until we get some strength up, and until the doctors know exactly how they want to go about it. You know, they talked about warm water therapy, and then they said, you know, pool therapy, that was the best thing for me, but the mechanism they used to get you into the pool would break my back. So, you know, it's still damage control. What other things are we controlling?
That was it.
Okay, and you know, the immunoglobulins in the IVIG treatment. When it was found out that, you know, I basically didn't have any, you know, that was just by happenstance. And but is when I was in ICU here, and the doctor, the oncologist here, he told me, and he was a stem cell transplant doctor here in Oklahoma City, but not for immuno. I'm
not sure.
What kind of disease do I have?
Autoimmune.
Autoimmune. See, my brain's hitting up for autoimmune diseases. But, you know, he started me on the IVIG, and he told me that it would probably be, usually it would take a year, but since mine was discovered so far out that he thought it would take 18 months. And now we're out 3 years or so, and he said at this point, because it's just not happening, that it just looks like that treatment, just consider it that it's going to be lifelong. And so I go do that. I do that every 3 weeks now, and it's definitely a lot better since we changed it from 4 to 3 weeks, because that 1 week in there, that last week, I was getting so sick and so run down. The last time I just told Dwayne, I said, I can't take a week like this. Something's going to have to change. And we spoke to the doctor, and he changed it to a 3 week. And it's been a great improvement. And I'm looking at all my notes that we went in. Bone density, we did that. Physical therapy and occupational therapy. The occupational therapist did fit me with a back brace that really does help support my back. When I'm up past a 45-degree angle, I'm going to be wearing the back brace, and it really does take the stress off of my back. So from our visit with the doctor and everything, we came out, you know, feeling a lot better, having a better understanding of exactly what was going on.
Kind of knew where everything stood on the lupus, so he basically said that, well, they said that basically the lupus is in remission. So we're experiencing, you know, a few symptoms of lupus that will cause her to have to take Plaquenil. but nothing any stronger. And then as far as everything else, it's a matter of just managing it the best that they can and we can until it gets better. Or, you know, certain things will get better, certain things, I don't know, we don't know. But as far as just managing the things that are damaged, like the bone density and you know, just over time, that should go up with the Forteo, and just the other things that were damaged from the treatments over time. So the good news on the lupus, the status of the lupus is that it's in remission, and everything else that we're dealing with that we didn't really know how to explain it is explained from damage due to that lupus either caused the damage, and it was damage that we're still overcoming, or that the damage was caused by some of the treatment to lupus, like the long-term high-dose steroids and then also the long-term chemotherapy.
So at least, like we said, we got to hear the R word for the first time and, you know, have a true understanding and a true feeling that, you know, that it really is there. Even though I know they said, you know, as bad as my lupus was, that what we have is so minimal that we're calling it remission. Because on me, it is minimal, based upon, you know, fighting for my life. And so I stand proudly with remission. And it's been a long, long road. We're both exhausted and worn out. But, you know, we're going to keep on going on until I get to feeling better. The next few videos we're going to go over, or I will, I don't know if Dwayne will be joining me, but go over like the year follow-up in Chicago and some events that have been happening since then. It's a lot of mind-boggling and a lot of overwhelming things. But we'll get to that on the next one. So I'll see you guys in the next video.